and Director General Mao Chun'an from the Planning Department of National Health Commission to take your questions. We also have Director Physician Gong Shusheng from the ENT Department of Friendly Hospital. Some updates on the epidemic. In the 24 hours on March the 3rd, according to statistics from 31 provinces and autonomous regions and the Xinjiang Production and Construction Corp, new confirmed cases 119, new deaths 38, including 37 from Hubei, 1 from Inner Mongolia, new suspected cases 143, newly cured and discharged from hospital 2,652, those off medical observation 6,250. Severe cases were reduced by 390. As of 24 o'clock, March the 3rd, according to statistics from the provinces and the municipalities and the Xinjiang Production Construction Corp, remaining confirmed cases 27,433, including 6,416 severe cases. Cumulatively cured and discharged from hospitals 49,856, cumulative deaths 2,981, cumulatively reported confirmed cases 80,270, remaining suspected cases 520, cumulatively traced close contacts 666,397, those still under medical observation 36,432. In Hubei province, new confirmed cases 115, including 114 from Wuhan. Newly cured and discharged from hospitals 2,389, including 1,859 from Wuhan. New deaths 37, including 31 from Wuhan. Remaining confirmed cases 25,905, including 22,368 in Wuhan. Severe cases 6,232 in Hubei province, including 5,723 in Wuhan. Cumulatively cured and discharged from hospitals 38,556, including 24,890 in Wuhan. Cumulative deaths 2,871, including 2,282 in Wuhan. Cumulatively confirmed cases 7,332, including 49,540 in Wuhan. New suspected cases 52, including 43 in Wuhan. Remaining suspected cases 340 in the province, including 234 in Wuhan. From Hong Kong, Macau, and Taiwan, cumulatively reported confirmed cases 152, including 100 in Hong Kong SAR, 10 in Macau SAR, and 42 in the Taiwan region. Apart from Hubei province, new confirmed cases 4, new suspected cases 91, new deaths 1. Severe cases were reduced by 29. If we look at the confirmed cases and the cure rate, 52% in Wuhan, 76.8% in cities outside Wuhan, and in other provinces, 87.3% are cured. For the next steps, we need to consolidate the previous achievements, use both Western and traditional Chinese medicine, closely monitor and provide comprehensive treatment to the severe cases to increase the cure rate and reduce fatality rate. To do a better job in diagnosis and treatment of the epidemic, NHC and China Traditional Medicine Administration have organized an experts panel to make analysis over the previous treatment, and there was another new revision to the diagnosis and treatment protocol. Now we have version 7. This new version has included the content of etiological changes, clinical symptoms, and the criteria for discharging have seen some newly added provisions. Different people groups will enjoy more precise and targeted treatment. Now we'd like to take questions from the floor. Please ask questions around today's topic, and please identify yourself before you address the question. The first question from the left side. Thank you. With Xinhua News Agency. We know the COVID-19 has been an epidemic with the widest spread and transmission, and the most difficult to control since the founding of New China. And there is a great need for medical devices and equipment. How were such needs met? I'd like to ask DG Luo Junjie and DG Mao Qun'an to answer this question. Thank you for your question. Under the deployment of the central government, MIIT acts as the leading agency to ensure supplies under the joint task force. The key medical devices needed have been divided into 4 categories, including 38 items, including treatment devices, testing, diagnosis, treatment, and disinfection devices. Since the outbreak, to meet the medical supply needs in Wuhan, Hubei, and in other provinces, we have been collaborating to organize the production in enterprises and make allocation among different provinces to meet the medical supply needs. We had a holistic planning and made analysis to predict the needs. Starting from the later part of January, we began such experts discussion. We categorized 40 medical devices, and we've put up a list of 200 plus manufacturers. We've set up a database. We've also organized people to trace the production and resumption of operation. Second, we have prioritized the health and safety of the general public. We organized domestic manufacturers' production, collected donations, and have some importation to ensure the needs. The non-invasive ventilators and the oxy-hydrogen breathing machines and ECMO devices have been followed to reduce the fatality rate. Third, we've orderly promoted the resumption of business to meet the supply needs. We have adopted various measures, including providing circulation of information. We've organized, set up some focal points. We've organized the local governments to coordinate such production in 25 provinces, 31 key manufacturers, and 2,000 components manufacturers were back on normal schedule of production, thus ensuring the normal running of the entire supply chain of the medical supplies. We've been collaborating with other departments and ministries and established fast tracks for transportation and customs clearance to ensure most needed medical devices can go to places where they are needed in a timely manner. As of yesterday, the enterprises on our list have provided 65,000 units of medical devices, including non-invasive ventilators, 14,000 plus, invasive ventilators, 2,900, ECG monitors, 15,000, and the breathing machines, 5,000, dialysis, over 100.
The positive pressure respirator, the bedside equipment, and the air disinfector or sanitizer have all been delivered. And it is fair to say that adequate medical equipment have already been provided. And of course, the high-end medical equipments are provided by coordinating with the relevant provincial governments. So we are continuously working on this aspect. Let's have DG Mao to make additional comments. Okay. Since the outbreak, under the overall coordination and arrangement of the State Council, NHC has been taking active measures to ensure the adequate supply of medical equipments. First, to strengthen the coordination and planning, we have a dedicated sub-team in the ministerial level commanding headquarters, and this dedicated team is working together with government agencies like MIT to ensure the adequate supply of the relevant medical equipments. Second, in the light of the actual needs in the front line, we developed an information system to collect the information, the demand information concerning medical equipments, and then with the State Council's joint mechanism, we are organizing the production and transportation of such equipments. Thirdly, we make every effort to ensure the adequate supply of such equipments together with the relevant working teams and the mechanisms. We have intensified the communication and made forward-looking analysis. Once the front line informs us the request for certain medical equipments, we will make every effort to provide such equipments as needed. Thank you. Let's continue. On the right, on the front row, the second lady reporter, please. Thank you. From Shenzhen Satellite TV, we found that some of the previous garment manufacturers are now shifting their production to the protective garments. So how about the current daily production capacity? And also, as the epidemic is trending towards the positive direction, how can such production capacity be dealt with in the future? Thank you. We will have Madam Cao to answer your question. Thank you for your question. With the sound coordination and arrangement, the relevant government agencies are supporting the potential businesses to shift their production, and therefore the production volume and the capacity of protective garments or suits have been ensured. Now we can satisfy the needs for protective suits. Every day, the number of protective suits that we coordinated has already been more than 250,000 sets, exceeding the need in Hubei. Now the number of cases is being reduced, yet we are still at a critical stage of epidemic containment, and the production of protective suits should not be slackened. For the next step, while ensuring the needs are satisfied in Hubei province, we also need to pay attention to the needs in other localities. We are also guiding the businesses to follow the latest developments and adopt a flexible approach to increase their effective supply. We are also aware that the epidemic is occurring in some other countries in the world, and they also faced with a shortage of protective suits. China is a major producer of such protective suits, and we encourage the local companies to try their best to satisfy the global needs so that we can make a contribution to the global efforts against the epidemic. Okay, let's continue. On the left, on the second row, the second reporter, please. From China Media Group, CCTV. My question is about the equipments. We would like to know that in the treatment of the epidemic, what are the high-end medical devices and equipments are utilized and how are they transported to Wuhan? And also the treatment of the critically ill cases remains to be a challenge. So what about the next step plan? And we will have DG Mao to answer the question. Okay, thank you for your question. In the COVID-19 clinical treatment, the previously well-known equipments like respirators, ECMOs, and P3 mobile laboratories, and etc. These high-end equipments are put into use and they play a very important role. These equipments are provided or brought with them by the various medical teams who rush to Wuhan to offer help. And also we have the national coordination to transfer such medical equipments to Wuhan and the Hubei province. The respirator and the ECMO are used to provide respiration support to the critically ill cases. And the P3 mobile laboratory is used for the makeshift hospitals, as these laboratories are mobile and can easily satisfy and fastly satisfy the testing needs. The mobile or the bedside CT scanner is very flexible and convenient for usage, so they can provide immediate access to CT scanning. As far as I know, the bedside CT scanner only takes 3 minutes to accomplish a chest scan. So these equipments are very helpful in the clinical diagnosis and the treatment. For the next step, according to the arrangement of the State Council's joint mechanism, we are going to further utilize the medical equipments and mobilize the equipments, distribute them among the hospitals in need. Let's continue. On the right, on the second row, the third reporter, please. The lady over there. Thank you. From the cover.cn. My question is about health. We know that with the work resumes, now we have the new approach of the health QR code, especially in Henan and Zhejiang provinces. So I would like to know the mutual recognition of the health code. Thank you for your question, and we will have DG Luo to answer your question. Thank you for your question. For this year's fight against the epidemic, we do enjoy a fairly favorable tool, that is the big data. According to the overall arrangement of the State Council, the IT companies are mobilized to adopt big data and the information technology to facilitate the epidemic control and containment. And such information is used to monitor the latest developments and provide trend analysis.
We collaborated with different ministries and departments and local governments and scored phasal achievements. For example, for the mobile users, there are online checks. Once the consumer has authorized the checks, then they can check the information about the provinces and places they've visited in the past 15 days. Ali and Tencent have also launched certain apps. for health information checks, and these have provided fast permits for those who want to go back to their workplaces. The interprovincial sharing of the information have also provided convenience to those who want to go back to their workplaces. In the monitoring and the usage of the data, we emphasize on the compliance with privacy protection laws. We ensure the protection of personal privacy and prevent against the leakage or the abuse or misuse of personal data. Thank you. Next question, please. Journalist from the third row on the right side. Thank you. With CCTV, I have a question on ECMO. We know the medical device plays an important role in the treating of gravely ill patients. So what is its role? Is Wuhan and the Hubei province still under shortfall of supply of ECMO? I'd like to first ask DG Luo to give his answer, and I'd like to ask DG Mao Qun to provide additional remarks, if any. Thank you for your question. Indeed, it's an important question. ECMO, the extracorporeal membrane oxygenation machine, can provide cardiorespiratory function support to the critically ill patients according to version 6 of treatment. On the critically ill and severe patients, ECMO is recommended for saving of the vital signs. Since the outbreak of the epidemic, in particular with the rise of confirmed severe cases and critically ill patients, Hubei and Wuhan have an increasing needs of ECMO. On 27th of February, the Central Government's work group has made it clear that ECMO needed to be allocated from across the country to Hubei and Wuhan to ensure that we try all the means to last the life of severe patients. Ministries and localities have tried all the means to allocate ECMO to Hubei. Recently, 67 ECMO devices have been allocated to Wuhan and Hubei. We urgently procured ECMO devices and transferred them to Hubei. Besides, on 27th of February, ministries and departments collaborated with each other, and within 15 hours, 16 imported ECMO from Frankfurt of Germany were transported to Wuhan and the Hubei province. NDRC and National Health Commission made great efforts to realize the provision of ECMO. They have allocated urgently ECMO that can be found in China, and also those medical assistance teams, when they went to Wuhan, they brought with them ECMO devices. In general, the provision of ECMO helped the saving of the gravely ill patients. And down the road, we will continue with the allocation of ECMO devices. We are thinking of importing another tranche of ECMO devices to Wuhan. We have been following closely the actual use of ECMO devices, and we further facilitated efforts in both domestic allocation and international importation. I'd like to ask DG Mao Qun to make some additional remark. I'd like to make some additional remark based on DG Luo's comment. Yes, indeed, as we send medical teams to Wuhan and Hubei province, many hospitals and medical teams have brought with them ECMO machines. However, it was pointed out that ECMOs are still in urgent needs. From the very beginning, we communicated with the hospitals that were under direct management of National Health Commission, and we made urgent allocation of 10 ECMO devices to Wuhan. We know across different provinces there are severe and critically ill patients, so it's fair to say that many hospitals need ECMO. But still, at the front line of the battlefield in Wuhan, there were further needs arising, so we asked different provinces for help. We did some analysis. We knew it was a difficult job because provinces had their own critically ill patients to be saved. So we discussed with different provinces. We sent out the notices of ECMO need to different provinces, and we thought if we still fail to meet the needs from Wuhan, and then we will contact them all and try everyone on the contact list. The notice was sent out on the evening of the previous day, and on the second day, my colleague sent me a message. He said, DG Mao, you don't have to worry. You don't have to call the provincial governors. We plan to allocate 10 ECMOs from different provinces, but from provinces across the country, we received the help from provinces. They say they want to donate 30. I was impressed and overwhelmed. I knew back then that provinces had their own critically ill patients to treat. They also need the ECMO, but still they want to help. So now we have already allocated 10 ECMOs to Wuhan, and we have 20 ECMO at hand. If any other province needs, the 20 ECMOs can also be distributed to them. So I'd like to take this opportunity to thank all those who have been lending their support in this special time. Yes, indeed, we stand united to ensure the needs are met. I'd like to thank the advantage of our institutional arrangements which has made this possible. Thank you. Next question, please. Journalist from the third row on the left side, please. From Economic Daily. We know many medical teams have brought with them the rescue devices when they went to Wuhan. The resources and the devices played an important role in rescuing life of patients in Wuhan. What were those specific roles? And by taking away these devices, will that dent the normal operation of the hospitals that have lent out these devices? I'd like to ask DG Mao Chuan to take the question. Yes, as I've mentioned, these medical teams brought with them the medical devices to Wuhan, which played an important role in rescuing patients, including respirators, ECG monitors, and ECMOs and others. They played an essential role in rescuing the lives of patients in Wuhan. In the Hubei province, we know at the front line of this battle, there were many critically ill patients. Without such devices, the medical workers would have been under much greater pressure. And for the future, with the coordinated arrangements from the central government, will discuss with Hubei province as to how can we bring out the full role of these medical devices. We need to equip the frontline medical workers with better devices.
Let's continue on the right, on the fourth row, the lady reporter. Thank you. From people's daily and health times, we know that protective suits are especially important for the medical professionals, and the production facility is really necessary. So my question is for MIT and how to ensure the adequate supply of such production device or equipment. Thank you for your question. Indeed, for medical protective gowns, the needs are growing. And up to now, it is still one of the top priorities for ensured supply. And indeed, the production facility you are mentioning are the bottlenecks for the production. This is Plowder. As previously, the producers of the Plowder were off work and off production, so there was a short supply of the Plowder, and we found it a big challenge to ensure the adequate supply of the Plowder. But we have the belief that the Plowder should not become the bottleneck for the production. So we have made every effort to increase the supply of the Plowders, and it is fair to say that in early February it was in severe shortage, but in mid-February the supply has increased, and now we can say that it is adequately provided and it can satisfy the production needs. In terms of work resumption, on the one hand, we make full use of the existing production capacity. We quickly got a survey to learn about the existing production capacity. So together with the relevant provinces and the working under the joint control mechanism of the State Council, we encourage the businesses to resume their production. And on the other hand, for other necessary supports for work resumption, we are making efforts to help the producers. For instance, we have sent dedicated staff to Guangdong province and work on site to encourage and mobilize the production capacity. We do have SMEs and producers who have demonstrated they are competence and they are devotion. For example, one company in Guangdong has made every effort to produce the Plowder. Now, by early March, there have been about 1,200 Plowders produced, satisfying the production needs of the protective suits. Also, companies have made positive response to the call, and in about 2 weeks, these companies have already produced 360 Plowder machines. Even though the produced Plowders cannot satisfy the growing needs for production, we have therefore called on the relevant companies and government agencies to mobilize the capacity. As you may have already been aware, we have called on the society to make contribution to the Plowder production. So there are producers who previously produced tents or other materials are now shifting their production to the Plowder production and the protective suits production. So this is about the supply. On the transportation side or the delivery side, in the light of the severe shortage in early February, we made every effort to coordinate the delivery in order to ensure the needs in Hubei province are satisfied as a top priority. So we have made overall planning and considered the local conditions for transportation and delivery. So it is fair to say that up to now, with all the potential channels mobilized, now we have 4,300 ploughder machines working around the clock. The daily production capacity of the ploughder is on average 150 sets. So every day we are able to produce about 600,000 protective suits to satisfy the needs. So it is fair to say that the current production can satisfy the need. However, we will continue to monitor the latest developments and make every effort to encourage production and ensure the supply. Thank you. Let's continue on the left. On the second row, the lady reporter, please. Thank you. From China Media Group, CNR. We noticed that the medical supplies in stock or the inventory of the medical supplies can only satisfy the need for a short period of time. So with this epidemic, any planning for future long-term stockpiling of medical supplies? We will have DG Mao to answer your question. Thank you. Indeed, the emergency inventory, it is really necessary for the epidemic. In responding to the epidemic, we do find some weaknesses or shortcomings in terms of the inventory. For example, how can we do a better job with the emergency response inventory, the supplies inventory? So the NHC is working together with the relevant agencies to make future plans. We have studied the existing emergency response inventory mechanism, and I think it is really necessary for future plans. Let's continue. On the left, on the fourth row, the first gentleman over there. Thank you. From China Media Group, from the new media. We know that in Wuhan, the critically ill cases are treated, and such treatment is at a crucial stage. There are two hospitals, Leishenshan and Huoshenshan, respectively, dedicated to the treatment of the critically ill cases. So how about the situation there? We will have DG Mao to answer your question. Thank you. I think it is fair to say that the adequate supply of the medical materials or the supplies is the prerequisite of a successful fight against the epidemic. So with the overall coordination and arrangement of the State Council, we can find some improvement. And it is fair to say that the supply and the demand is now in a balance. And we are also closely following the latest developments in the front line and make every effort to ensure the adequate supply. Okay, let's continue. On the right, on the fifth row, the third gentleman reporter there, please.
With Phoenix TV, since the outbreak of the epidemic, the government has been updating the diagnosis and treatment protocol, as you've mentioned, already to the 7th edition. I'd like to ask about the supply of the drugs and the devices that are recommended by this protocol. I'd like to ask Madam Cao Xuequn from MIIT to take the question. The diagnosis and treatment protocol and the experts' opinions and suggestions have been guiding our efforts of allocation. 30 plus drugs, 70 plus TCM tablets and liquids are under dynamic monitoring daily. Alpha interferon hormone drugs, testing kits, and other key products can meet the needs from frontline in Hubei and in Wuhan. TCM drugs, tablets, and liquids are also under normal production with adequate inventory. Since the Spring Festival break, we've been supporting relevant manufacturers to resume their production, dealing with issues on the transportation, the coming back of the workers. 6 manufacturers have resumed the production of chlorine phosphate with an adequate market supply. And chlorine phosphate that has been transported to Hubei can meet the needs of 150,000 person times. Abidol's production is also in normal production capacity, which can meet the clinical needs. And in the future, we will do an active job in connecting the supply with the demand, in particular the drugs. In particular, we will look at the research progress of experts on products and drugs with a good efficacy and organized production. We are confident and we are capable of meeting the therapeutic drug needs in Hubei and across the country. Thank you. Next question, please. Journalist from the second row on the right side with the CCTV, the financial channel. Designated hospitals and the temporary hospitals have seen many vacant beds, but are patients still waiting for the treatment from the medical devices? What about the quarantine and the isolation centers? Are these centers well equipped with medical devices? I'd like to ask DG Mao Chuan to take the question. Currently, we've guided Hubei province and established standard on medical supply equipment at different types of health institutions, so there are no worry. There aren't patients who are waiting for the treatment provided by the devices. Previously, there was a short span of time where Hubei was in dire shortage of medical supplies, but now it is balanced, including the isolation and quarantine centers. They are equipped with needed and standardized medical devices. Thank you. Next question, please. Journalist from the 5th row on the left side, please. Thank you. Dragon TV. We know it is urgent for us to treat the gravely ill patients. However, we know normally hospitals need to go through procedures before the medical devices can arrive the institutions. What are the special measures we've adopted to ensure the faster track? I'd like to ask DG Mao Chuan to take the question. As you know, medical institutions have to go through procedures for the procurement of medical devices, in particular, the expensive, sophisticated medical devices. In face of this epidemic, Ministry of Finance has responded immediately and issued the notice on facilitating the convenience of medical device acquisition. For the acquisition of the medical devices targeting at the epidemic response, a green fast track was established, ensuring hospitals and health institutions can procure the needed medical device as quickly as possible. And this notice has played a very positive role, ensuring the needs of treatment were met immediately. We can only take the last two questions. Journalist from the fourth row on the left side, please. Thank you. With Beijing News.